السلام عليكم جميعا. First of all, I want to thank you all for all the interactions and the comments that you write and participate in our first case. So now I decided to present another case and wait for your answers and interaction with us. This case is about a 58-year-old male patient who's presented with a bulge on the head for long duration and with headache. So MRI was requested, and let's see what do we have here. This is a T2 axial images of the brain. You can appreciate it's a T2 just by looking at the eye globes and seeing what bright it is. You can see the brain parenchyma here. Till now it's basically normal until we reach this area, and what do we have here? We have something, okay, this here, that's causing mass effect on the adjacent brain parenchyma. It's a lesion that is causing mass effect on the adjacent brain parenchyma, and this mass effect is associated with some edema within the brain parenchyma. However, this lesion is surrounding this thing, which is the superior sagittal sinus, and it's infiltrating the bone and it's bulging to the outside of the scalp, into the subcutaneous tissues, into the scalp. Okay, this thing here, it appears possibly heterogeneously hyperintense on T2 weighted images, and let's see some other sequence. For example, an axial T1 weighted image. We can see that this is a T1 axial just by looking at the eye globe and see that the fluid, the water is dark, or maybe at the CSF in the ventricle you can see it's dark. This is a T1 weighted image, and you can see the lesion here. It's relatively maybe iso to hypointense, mostly iso-intense, and it's invading the adjacent bone and it's bulging on the outside of the bone into the scalp of the patient. Now let's see the sagittal image, or this is a sagittal T2. Of course, you can see the fluid is bright, and you can see the in the eye globe and in the lateral ventricle. This is a T2 weighted image, and so the sagittal T2 fat sat will show us the same lesion here. Sagittal T2 weighted image, not fat saturated, because you can see the fat here in the subcutaneous tissues as a bright signal intensity. So this is just a sagittal T2 weighted image, and it shows us the lesion here. It is based on the bone, and it's causing mass effect on the adjacent brain, and it's bulging on the outside of the skull, penetrating the bone and causing mass effect on the adjacent brain. So first of all, we need to determine whether this lesion is intra-axial or extra-axial, and this is whenever there is any lesion related to the brain or surrounding structures, the first thing you need to do is to determine whether it is an extra or extra-axial lesion. So let's see, is this an extra-axial or intra-axial? Definitely this is an extra-axial lesion. And what are the signs that help us to determine that this is an extra-axial? That is, it's arising not from brain parenchyma but from adjacent tissues. First of all, we have the CSF cleft sign. You can see the CSF cleft separating the lesion from the adjacent brain parenchyma. You can see buckling of the brain parenchyma. It's buckled inside, not replaced, not invaded, buckling of the brain parenchyma, and you can see that there is a broad angle between the lesion and the adjacent dura, so it is arising from the outside the brain, not from the brain. So these are the signs that help us to determine that this lesion is an extra-axial lesion. Now, what should we do next? I think obviously we, as in any intracranial mass, or in fact in any mass, we need to give contrast to see what the lesion will show as pattern of contrast enhancement. So what do you think will happen? What kind of contrast enhancement will happen in this lesion? And if you know the diagnosis, of course you will say there will be marked post-contrast enhancement. You can see here, this is the lesion and it is enhancing well, it's infiltrating the bone and enhancing on the outside of the bone, and you can see this is the tail of the mass, the dural tail sign. And let's see here again, it's enhancing and it has a marked dural tail, enhancing both inside and outside. Okay, and you can see the enhancement here with the dural tail sign. So what do you think is the diagnosis? Please write your answer in the comment section, and we will meet after a few hours to discuss the findings and the diagnosis. Thank you very much.